Donald, nice to meet you. My name's Laura, I'm a physio. I understand you've been having problems with your left shoulder, is that right? We're going to go through an examination. We're going to have a look at your range of movement and your strength, and then we'll do some special tests to see if there's any problems within the structures of your shoulder.
Sure.
Throughout the examination, can you please just let me know if you experience the pain that you've been having in your shoulder, or in fact if you're just a bit uncomfortable, and we'll see if we need to modify that.
Okay.
All right. All right, let's have a look then. First of all, we'll just start by having a little look at your shoulder. Just assess the position and your posture. And now we're going to have a look at your range of movement. So first of all, if you can just lead with your thumbs and take your arms all the way up to the ceiling, as high as you can go. Good. Are you happy with that? Mm-hmm. Lovely. And come back down. And now starting with your arms by your side, just taking them all the way out and all the way up to your ears. Lovely. Good. And then come back down. Good. And then just with a little bit of a bend in your elbows, you're going to take your arms all the way behind you as high as you can go. Lovely. Any problems with that?
No.
Right. And relax back down. Good. Now, if you just take this arm into this position, and you're just going to have your other arm matching there, and we're going to turn out to the side. Lovely. And then relax. And then one arm at a side, just across your tummy. Good. Okay. Now we're going to come up so your arms are at 90 degrees, and then you're just going to take your palms up to, lovely. How does that one feel? Good. And now your palms all the way down. Good. Happy with that? Lovely. Relax back down then. So let's just start here in the middle and have a little feel of the joint in the middle there. And any problems across there? It's feeling nice and level. And then we'll just work our way along your collarbone there. And there's no problems with that, not having any pain. Then we just come out to the little joint here at the end. Good. And then all the way along to the very edge. Good. And then we'll just come in onto the actual head of your shoulder there. Good. And again, no problems?
No.
Lovely. And relax. So we'll have a little look at your strength. If you hold your arm out at this position, and just now don't let me push you down. So push. Good. And then relax. Come out to the side here, and then don't let me push you down. Good. And then bend your arm in here, and then you're just going to pull your arm behind you and pull back. Good. And then relax. Now keeping your arm at your side, I want you just to push into my hand, and we're just going to do that turning movement again.
Okay.
Okay. So again, just pushing out. Lovely. And then this time pushing in. Good. Arms back out to 90, up in that position. That's it. You can relax that one down. And we're just going to push up in that position. Good. And now we're just going to do that rotation here again. All right. So bringing your arm up. Push, 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 push. Good. And now pushing down. Lovely. And then relax. Good. So they all seem fine. Now let's have a little look. Bringing this arm in here. Just rest it onto my shoulder there. And then if I take your arm down like that, how does that feel?
That's fine.
Good. And now if I bring your arm all the way across, hold it there, and we're just going to give you a little bit of a push further around. Any problems with that?
No.
Good. Okay. Relaxing all the way down there. If you hold your arm out here now, and then you're just going to turn down. Good. Can you push out just up in that position? Good. And now turn your hand up to the ceiling, just so your thumb's there. Lovely. And then push up to the ceiling. Good. Okay. Relax that arm down. You're going to take this arm now and just tuck it in behind your back. Lovely. And now can you just lift your arm off your lower back there? Good. And then relax. Bring your arm round to your tummy. Good. And then I'm just going to slip my hand in there, and then just pull your hand into your tummy. Lovely. And relax there. Good. Just pop your arms down on your knees now. Donald, we're just going to have a little look at the stability of your shoulder here at the front. So if I take your arm out to the side here, and then if we just slowly bring it all the way back, and just let me know if there's any problems there. And then we'll come back. We're just going to do the same again with some pressure all the way around there. Okay, you happy with that? So we completed a basic examination of Donald's shoulder. We looked at his active range of movement with some overpressure at the end of range. We looked at the strength of those movements, and then we moved on to look at the integrity of his shoulder. So in supine, we did an apprehension test which looks at the anterior stability of his shoulder. In standing, we had a look at his integrity of the rotator cuff muscles and also the intra-articular structures. We also assessed along his bony prominences from the joints across the front of his chest, along his clavicles and out to his acromion and into his glenohumeral joint to see whether there was any deformities or any tenderness.